Abdominal auscultation. When examining the abdomen, always auscultate before palpating or percussing. Mentally divide the abdomen into 4 quadrants, listening with the diaphragm of your stethoscope in each quadrant. The number of gurgles can vary, but 5 to 35 gurgles per minute is considered a normal finding. Increased bowel sounds caused by gastroenteritis or hunger are referred to as borborygmi. Decreased bowel sounds can occur with peritonitis or paralytic ileus. You must listen for 5 minutes before determining that there is a total absence in bowel sounds.